Let's talk about a new study that found the popular weight loss drug Wegovy may also reduce the risk of death from COVID. That study, published in the Journal of American College of Cardiology, found that people with obesity and heart disease taking Wegovy during the COVID pandemic were less likely to die from the virus. So let's bring in ABC News medical correspondent Dr. Darian Sutton to talk more about this. We hear so much about these weight loss drugs and their effect on people's health, not just weight loss, but other things as well. What do you make of this new study?
I think that these are such significant findings, Rhiannon. So as you said, the participants were either obese or overweight with a history of heart disease. Important to acknowledge because those are two risk factors that increase one's risk of complications from COVID and even death. But what I take from this is that it tells us so much more or so much less about what we know about obesity and its connection to our health outcomes. I think medications like Wegovy and these other injectable medications for weight loss are another puzzle piece in this larger picture of the connection between obesity and our health that we're only beginning to understand.
Right. Hopefully more research will be done so we can try to understand that a little more. A lot of people talking about, because officials are raising the alarm on two mosquito-borne illnesses, West Nile and Triple E.
Yes.
So a lot of people concerned about this. What do we need to know about the differences between the two of these in risk and even in symptoms?
So in terms of Triple E, Eastern equine encephalitis, and West Nile, they're both mosquito-borne illnesses. They can both start with flu-like symptoms, but their outcomes are relatively different, and who they affect most are relatively different. So if you look at Triple E, those who are most at risk include those under the age of 15 and those over the age of 50. Symptoms often start about 4 to 10 days after exposure. And I think just to provide some context, because it can be frightening when you hear about the risk of death with Triple E, this is still rare. If you look at the numbers from last year, it's estimated that only 1 out of every 10 million people will get this infection. Of those who get infected, about 5% will become severely ill, and then a third might die. And then in terms of West Nile, it's also relatively rare. So taking that in note and then preventing mosquito bites as much as you can.
And how do we prevent those when you're traveling to these areas with high mosquito activity? I know New York City, they were just spraying for mosquitoes within the last few weeks.
Yeah.
So what should people do?
I think if you have a home, walk around that home once a week. Get rid of standing water. That includes water in toys, tires, and your gutters. And then when you're outside, I think getting on that protection. Unfortunately, we are in mosquito season. It goes from the late summer into early fall. So wearing repellent, whether that be DEET or eucalyptus oil, long sleeve clothing, treating it with permethrin, and then of course just being cognizant of your risk.
Can eucalyptus oil really protect you?
Lemon eucalyptus oil is actually known to protect against mosquito bites, so yeah, I think it's an effective form of repellent.
I like that.
Yeah.
Last question, I want to ask you about a new study, because this one was just released at a medical conference in Europe, and it's important for people who don't get a lot of sleep like us. It signaled that sleeping on weekends may lower your risk, sleeping in may lower your risk of heart disease by up to 20%. What do you think?
It's focusing on those who are already sleep deprived, and so it's focusing on those, but I will say that we talk about this all the time. Does sleeping in on the weekends benefit us? I think overall it's still a if. We don't know for sure, but getting as much sleep as possible the day of is really important. Sleep is connected to our overall health, so making sure that you're consistent and getting that sleep.
It's good to hear. I'll try to get more sleep, Dr. Darian. You too. I know. Thank you for that.